Hi, and welcome to the Keys to Therapy. Today's guest is Libby. Hey, Libby.
Hi.
So
Thank
glad to have you
thank you
here.
so much for having me. I am just so excited to be here. And I am really excited about what you're doing, which is really creating something for, new therapists to listen to and, engage with. So thank you for what you're doing.
Yeah, of course. I feel like I didn't have these resources. I don't know if you had anything like this, but it's like, people say, like, be who you wish you had when you were younger. That's kind of what I'm doing with this. Like, do what I needed when I was younger, because it would have been great to learn about EMDR a lot sooner than when I did.
Absolutely. And I think that's the thing, right? Like we all have these wonderful experiences in graduate school, and there's so much ground that we cover. And
Hmm.
there are so many things that we are kind of left to discover after our masters or whatever type of higher level education that we end up doing. So I agree with you. There's definitely spaces for us to kind of fill in and give the folks maybe something they didn't get. So
Yeah, exactly. So before we get started with all the questions I have, and there's quite a few, if you just want to tell the audience a little bit about who you are and what you do.
yes. So, as you were saying, I'm Libby Murdoch. I'm a licensed professional counselor. I'm also a certified clinical trauma professional, and I'm certified in choice theory and reality therapy. So, that's just a little bit about kind of my clinical side of things. I'm dually licensed in Ohio and North Carolina. So, I actually have my own private practice called Brain Based Counseling and Consulting. And I do a few different things within my private practice. So, I do one-to-one individual therapy. I don't actually have a physical practice location, so a lot of that is done virtually, which is really cool because I know even you mentioned there were some curiosities about, hey, does EMDR work virtually? And
Yeah.
yes, it does. That's so exciting. Actually, most of my own EMDR therapy has been done virtually, as in I've received it as a client.
Mm,
So that's just one side of the practice, though. The other thing I get to do that I really love and enjoy doing is what's called EMDR intensives.
mm,
Um, and people hear EMDR intensive and they might kind of get the wrong idea. And intensive is really kind of like just a fast pass for therapy. So
mm.
instead of weekly therapy, where you might take a few weeks to even a few months to really like, get prepared and get started in the deeper work, when we do an intensive, we spend a good amount of time together. And so we're able to kind of go through that process a little bit quicker.
Mhm.
So I have a day and a half program, excuse me. And what I like to tell folks is in a day and a half, I can take someone from being a brand new client to doing meaningful work with EMDR as long as they are safe and stable enough to do so. So it's kind of like doing 3 months of therapy in a day and a half, which is just not
Wow.
only super rewarding, for me to get to see that transformation, but a lot of my clients have also found that to be extremely beneficial because then they're able to get some kind of results
Mhm.
sooner than maybe they would have if they were doing more traditional weekly therapy. So that's the private practice. And then
Mhm.
secondarily, I am also a trainer. So one thing you will learn about me, and I hope I'll get to share a little bit in this podcast today, is that I'm kind of a brain nerd. I love neurobiology, and that has kind of been a fascination for me. So that is what took me into this area, just this passion for learning. And then eventually I decided to share that knowledge and information with other people. I'm a big believer in, if knowledge is power, I want to use my power to empower other people.
Mhm.
Because I can only do so much direct one-to-one. So
Right.
I'm at a place in my career where I look at options and opportunities for multiplying. And
Mhm.
so that's one thing that I get to do when I do trainings for folks. And I do trainings on a variety of areas. I talk about things like resilience, relationships, trauma, addiction. And then I'm actually also a basic trainer for EMDR through MDREA, which is the International Association of EMDR.
Wow.
So, yes, I stay busy. That's
Yeah,
for
no kidding. But I love that you've taken something that you love and a modality that really speaks to you, and you've been able to expand on that in multiple ways with clinicians, with clients, for yourself. Like, that's amazing.
Absolutely. And I think I said this to you earlier, but I think it bears repeating. In my humble opinion, the best clinicians of EMDR are actually also clients of EMDR
Mhm.
because it really does give you a different sort of appreciation for not only what EMDR is like and that process, which is really different than talk therapy.
Yeah.
But also gives you kind of a knowledge and appreciation for the results and the effectiveness of EMDR. And that is one thing that I will say as a client of EMDR, my therapist knows when I come to see her, I'm like, shh, we're not going to talk. We're just going to, because I always end up feeling better at the end of the hour when we
Yeah.
do EMDR processing. Whereas, if I've sat and talked with her, I might have co-regulated, right? Meaning that
Mhm.
her nervous system may have had some influence on my nervous system, and it may kind of have that calming effect. But what I've noticed is different is that with the EMDR, that change in how I'm thinking and feeling actually then leads to change in how I'm showing up outside of my therapy, which to me is, a really cool thing that we can do with EMDR.
Yeah, absolutely. The way that I've always thought about it is it kind of gets to the deeper parts of you. It allows some of that, maybe, especially for the very analytical people, some of those mental blocks that they may have sometimes with talk therapy to get to the emotional stuff. Because I saw when I went through the training, I was the first client in whatever, I can't remember the word for it.
In your practice, your
Yeah,
practice.
yeah. And so I was the first one. I was like, here we go. And then within like 5 minutes of doing the processing, I was like, okay, I'm crying, but I don't actually know why. Because, and they were like, well, you were too little when, that hurricane hit and you're feeling it in your body because your brain didn't consciously recall things, but your body stored it. And I was like, okay, it's working.
Yeah.
And so deeper things that maybe you don't even fully realize that are stored there come out. And I just thought that that was so cool.
Yes, I
Scary.
love the way that you even said that too, like it gets to the deeper parts of you. Um,
Mhm.
a way that we would kind of refer to EMDR is that it's a bottom up method of
Ah,
therapy. So
mhm.
if you kind of think about traditional talk therapy, and this is, I'm going to go nerdy if it's okay. I'm going to bust out my hand
Love it.
because this is how I like to explain to folks some of these things that we're going to talk about, and we can literally highlight how does EMDR get to the deeper parts of us. But
Yeah.
if this were your brain, and I do want to cite this comes from Dan Siegel. I'm not the inventor of the hand brain, so you can YouTube if you're interested to learn more. But if you touch your forearm, that's actually going to represent your spinal cord, and then
Mhm.
if you were to touch the palm of your hand, that's going to represent your brain stem, responsible for all the things you don't want to think about, your heart rate, your blood pressure, your digestion. If you fold your finger or your thumb in there over that palm, that's going to be the limbic system.
Mm,
That's kind of the seat for emotion and motivation. And
mhm.
together, that thumb and that palm, this is what we would refer to as your downstairs brain, meaning that these are your survival centers. The things happening here are not happening with thought control, right? It's kind
Okay.
of beyond conscious control. So then, if you fold your fingers down over your thumb, that's actually going to be your cortex or your thinking part of the brain. And when we look at kind of traditional talk therapy, at least for the
Mhm.
most part, it's engaging this part, right?
Mhm.
And
Mhm.
this is the part of our brain that we can control with our thoughts. But interestingly enough, guess what part of your brain, things like negative experiences, trauma, toxic stress, guess what part of the brain that changes?
That's gonna be that deep part.
The downstairs brain, right? And so that's
Yeah.
kind of the cool thing about EMDR is that when I am doing an EMDR processing session with a client, I am actually activating this downstairs
Mhm.
part of the brain with which the research helps us to understand. We
Yeah.
have to kind of activate that old network in order to be able to do something with it. So here's another fun neurobiological term, neuroplasticity.
Mhm.
Right. So, and when you hear that, you just think plastic because that's really all we're doing. By activating this downstairs brain, we're kind of bringing out that plastic quality, meaning that we can change something that
Mhm.
has maybe already been changed by the trauma. And so with EMDR, we'll activate this downstairs brain. But in the process, we also stop, we take breaths, we ask people to tell us what they're noticing and scale how disturbing things are to them. And that is actually flipping them into the upstairs brain and sometimes into the left hemisphere, especially when we ask those scaling questions. So that's kind of the cool thing about EMDR is that
Yeah.
it's flipping back and forth between the upstairs and downstairs brain, and it's actually promoting what we would call neural integration, right? It's allowing those memories that have kind of been stuck in the downstairs brain and in the body to be released and then stored in a different way, so that they don't have to show up as much and impact how we're thinking, feeling, and behaving. So all that to kind of, like you were teaching us some neuroscience and you didn't even know it with that comment.
Yeah, but I love that. And I'm so happy this is on YouTube because then you can physically see everything. And that makes so much more sense. And I know for me, I'm more of a visual person.
Yeah.
So I'm hoping that that really resonates for some people. And with clients, I feel like that's a very clean way to explain it because I've had a lot of clients with EMDR when I was practicing in person be like, I don't know. I just think you're supposed to talk about stuff. Or even concepts within it. Like you said, you mentioned tapping or
Yep.
things like that and not fully understanding what that means. And I think what I've noticed too is sometimes clinicians can't explain what it means. They're just kind of like, but it works.
Yeah.
And so I think being able to have that deeper understanding yourself also helps with client buy-in to
Oh, yeah.
trying this out. And even for like, I would also think just even that understanding outside of EMDR for clients who are maybe dealing with trauma or feeling guilty, powerless,
Yeah.
any negative emotions associated, like I can't control. If you're able to explain, but this is where it's stored, and
Yeah.
that's not something you could just access whenever you want necessarily. Your brain kind of won't let you sometimes. That may help with some of the shame associated with trauma too, just being able to have that visual.
Yes, yes. Oh my God, there's so many different ways that I could go because there's just so many golden nuggets that you were just kind of bringing up for me right there. But I think the first thing that comes up for me there is just, kind of what you were saying, and that being able to help someone understand how is EMDR kind of affecting the kind of healing that we're looking for and that we want to see. And I'm a big believer in sell the results, not the product. So when I'm
Mhm.
working with a client who's maybe interested in EMDR, I'm looking at what are their symptoms and then how can I connect those symptoms with the outcomes that we see from EMDR, because it has really been, EMDR is evidence based. I know that's
Okay.
something, that is kind of important clinically. I don't know that clients care so much about the
No.
evidence, but it has been shown to treat not only trauma, but
Mhm.
also things like anxiety and depression. So it is a well-researched supported intervention. And it really is shown to change the way that we think, feel, and behave. It's shown to reduce triggers. It's shown to improve sleep. It's shown to, um, increase confidence just in ways that, for me, at least I haven't seen or experienced when doing more of those top down modalities, which we can
Mhm.
kind of put talk therapy in that category. And I totally agree with what you're saying. And, in terms of people needing to be able to explain more of that neurobiological piece. And I'm a big believer that anybody can have a conversation about the brain, per the example we just gave with the hand brain. It really
Yeah.
doesn't have to be something that's complex. And
Mhm.
so that's a big reason why, as I have been working on developing my own resilience focused basic EMDR training curriculum, I've really pulled in a lot of the neurobiology and focused
Mhm.
on how can we not only, make basic EMDR accessible to folks who are learning, but to also empower them to be able to give some of that science, that psychoeducation, as it were,
Yeah.
about EMDR and about trauma, about our nervous system. Because even for me personally, as a practitioner of EMDR, there are areas in EMDR that I think aren't used to their full extent because people
Mhm.
don't fully understand from the, again, neurobiological perspective, just how effective and change making those aspects of EMDR can be. And in particular, I'm kind of referring to what we in EMDR would say like phase two, which is our
Mhm.
preparation and
Right.
resourcing. And
Mhm.
that's where we build different skills, tools for our clients, and that helps them to be able to shift their internal experience and actually also create good feelings inside their nervous system.
Yeah, which that kind of brings me to because I feel like in me getting excited, I jumped ahead a little bit, which is good because I like going around and figuring it all out. But I wanted to ask, I guess, as we're going into this, because you could tell that you're passionate about it. But why did you choose to get trained in this? Like,
Yeah.
why? What about this? Because there's so many modalities or so many different things out here. So why EMDR?
Yeah. So it's kind of like it's a little bit of a story, and it actually does go back to the Christmas that I was in the midst of my master's program. For
Hmm.
Christmas, my mom actually got me a book called Brain on Fire. And
Ooh,
if you haven't read it, it's a New York Times bestseller. It was actually also made into a movie on Netflix, but it's a
yeah.
really good movie. And what I'll do is just kind of summarize the effect that the book had on me, which was to really impress upon me the importance of what I'm going to do as a mental health professional and the need to have some knowledge about the brain and
Mm,
even how different things that I'm doing are maybe affecting the brain. And so, with that being said, I sought out mentorship then when I was moving into the actual, internship portion of my master's education. I sought out mentorship that could really help me hone that skill and that ability to know more about the neurobiology. Through that, I started taking trainings with my mentor, and we were a part of a traumatic stress certificate program um,
hmm.
that was out of the Trauma Resource Institute, and that's in Boston. I
Wow.
think Bessel van der Kolk used to head the program. I'm not sure if he does anymore, but so we took this really in-depth program, and it was essentially exploring what are the things that are going on in the frontier, right? Like kind of in the cutting edge of trauma work. And so Bessel had a talk actually on EMDR, and that was the thing that really got me interested in EMDR. And a couple key takeaways that I can remember from the course, and just kind of things that really hit home. When Bessel van der Kolk, he like heard about EMDR, he got curious about it. He decides he's going to go to a training. He says that at the training, he got paired with someone and that person didn't like him. So that person did not want to divulge his trauma to Bessel. And so Bessel went from being a skeptic to thinking, okay, well, now this definitely isn't going to work because the person isn't even willing to share with me what happened. And lo and behold, the person got better. And so Bessel became a real believer in the
Yeah.
process of EMDR. And again, more to that top down versus bottom up approach. Bessel was kind of saying that, with our bottom up approaches, it may be more effective and efficient. So kind of the metaphor that he used was that maybe using top down approaches to heal trauma would be effectively like trying to take someone's tonsils out through their nose. Like you can
Mm,
do it, but why would you if there's a more
mhm.
direct route for that? So that was really what got me interested in EMDR. And then back in 2016, I went and took my basic training. And I will tell you what, and I say this now because I am an EMDR trainer. I
Yeah.
get to train a new cohort about once a month. And I say this to folks when they're starting because this was my experience, which is that becoming EMDR trained will not only change your clinical practice, it will change your life if you let it. And so that
Mhm.
was my experience starting back in 2016. And it has been a journey since then.
That's
So,
amazing. But I love how, because again, sometimes in school, they don't, there's a lot of theoretical things that they have to cover, right? Because school's pretty much just the foundation. So it
yes,
tends to be not every program, but most of them tend to give you so much of the Freud, the CBT stuff, the imprinting, like all these different like classic theories. But
yes,
there's not as much about some of the things that are more recent or some of the things that are starting to come out or gain traction or anything else. And I don't know if it's just because the curriculums are maybe a little outdated, or maybe some people might get in trouble for talking about some of the newer stuff. I don't know. But that leaves a lot of newer therapists going, okay, well, I've got all these theories I know, but I'm not really sure how to put stuff into practice or which populations, which things work best for who, and all of that stuff. So, with this in particular, with EMDR, say that there's a clinician who's interested in it, or maybe they potentially have a client who they think it may be a good fit for. What
yes.
would be the criteria for somebody to refer a client to EMDR or use EMDR with a client?
Yes. So I want to answer that question, but can I quickly go back to something that you
Absolutely.
were saying? Because you just kind of triggered a golden nugget that I want to be able to share with folks. Because
Yeah.
I think for me, and more to your point, we cover certain theory in our, higher level education, but we don't cover all of the theoretical approaches. And so for me, EMDR has been a major game changer just in not only how I look at myself, but how
Mhm.
I look at the world around me. And it has really led to deeper compassion for myself and for my clients. And so I think the theoretical orientation of EMDR in and of itself can actually kind of be a game changer for folks. And this is more to some of what we initially started talking about, which is like, what is EMDR? How do you explain EMDR? And the two ways that we like to summarize kind of the model behind EMDR is the past is in the present,
Mhm.
and then the brain and body have a natural drive towards health and healing. So let's kind of hone in on the first one. The past is in the present. In
Mhm.
EMDR, we look at any symptom or any issue, challenge a client is having when they come into the office to see us. We look at that in the form of unresolved environments, relationships, and experiences from that client's past, which is to
Mhm.
say that if you're having a problem, if you're struggling, in fact, there's nothing wrong with you, right?
Mhm.
Neurobiologically, we were designed to be shaped by and for our environments, relationships, and experiences. So if I am having some sort of symptoms,
Mhm.
the way that EMDR would see that is that there is some sort of an unresolved memory or memory network that is now kind of leading to what we frame as a negative belief. You might have also heard them called limiting beliefs.
Mhm.
And those narratives or stories that we have internally really affect the way that we show up. And this can lead to all sorts of things: anxiety, depression, PTSD, but it
Mhm.
can also lead to a lot of things that you aren't going to find in the DSM. Our attachment style,
Yeah.
if we are a perfectionist, if we're a people pleaser, if we experience imposter syndrome. And so that's the other cool thing that we can really share about EMDR is that based on the theory and the perspective of EMDR, you don't necessarily have to have a diagnosable issue to benefit from EMDR because everyone's past is in their present. And if we have
Mhm.
things that are happening in our life, symptoms, challenges, patterns of things that we're not happy with, EMDR gives us a way to kind of isolate where did those things come from, and then to kind of free ourselves through a process of positive trauma resolution.
Mm.
Now, the second part was the brain and body have a natural drive toward health and healing. And how cool is that? That EMDR is literally like jumpstarting a dead car battery,
Yeah.
right? Like for the clinician, we jumpstart that car battery, in this case, the brain and the body, and we're kind of able to restart that process towards healing. So we are really just using the inherent wisdom of the client's brain, body, their own nervous system. And if that isn't what they told us counseling was in graduate school, like
Yeah.
I do not.
No, thank you.
So, but then we got all these tools that were really like dependent on us to guide the session and take it
Mhm.
somewhere, which is why I love EMDR so much, because it really is just restarting or jump starting a client's natural capacity to heal themselves. And I'm just kind of there as the guide and the facilitator. I'm not the guru with all the
Mhm.
answers. So
Yeah, but I feel like that would be so comforting for new therapists, especially because a lot of these other modalities, like the classic ones that we're typically taught, there's not a lot of like practical techniques. It's more so like here's the theories behind it, here's why people came up with it, here's some for CBT, for example, here's some worksheets that you can do with clients, but that leaves a lot to the clinician to do kind of all the rest of the work and initiate at least that work with the client. Obviously, the client's the one that's supposed to do the majority of the work, but I think for new clinicians in particular who are sitting there going, now what do I do? Now, how does
exactly.
this work? Having a framework like EMDR, which you don't even start the reprocessing for a while, there's all this foundation in the beginning. I think having maybe such a clear step process to building to that, to having a space that you cover resourcing,
Yeah.
to going over those timelines, like that may be really comforting for a new therapist to have a literal handbook on
Oh,
that.
yeah. Yeah. There's a lot of structure in EMDR. And I would
Mhm.
also say there's a lot of room in EMDR to tailor it to the person that's sitting across from you. But I know you mentioned just kind of the question about, who would you look to refer to EMDR? I think we kind of touched on just a little bit
Mhm.
of that, but we can kind of touch on that just a little bit more. Again, EMDR is evidence-based, meaning that there is a well-established body of research that supports the effectiveness of EMDR with diagnoses like PTSD,
Mhm.
depression, anxiety. And so for me, EMDR is my primary approach, when kind of addressing any of those issues in therapy. But like I mentioned, based on what we understand about the theory behind EMDR, your client doesn't necessarily have to have those diagnoses to
Mhm.
benefit from EMDR, because the idea is that any symptom, any challenge, any pattern that they're wanting to work on can be traced back to those earlier environments, relationships, and experiences, and then we can work through that with EMDR. So in the basic training, which is a good thing, there is actually a section, and you get to practice kind of going through what we would call client selection criteria.
Mm.
And so you get a whole lot more of that in the basic training. But what I will say is that EMDR is a very powerful intervention. And so, although it can be used for a wide variety of clients and a lot of people can really benefit from EMDR, there really are certain folks and certain populations where EMDR may not necessarily be the best fit. And the
Mhm.
one that always comes up for me is high level dissociation. So,
Yeah.
someone who maybe has something like a dissociative disorder not otherwise specified, or a dissociative identity disorder. And just
Mhm.
based on my training and experience, those populations, EMDR might actually result in a breakdown instead of a breakthrough,
Yeah.
especially if those folks haven't had a good amount of time in therapy to really kind of establish that capacity to be present in their own body, and
Mhm.
even kind of work on some integration of parts of those systems. So yeah, I mean, there aren't very many things that would, let's say, kind of make a client not a candidate for EMDR, even when
Yeah.
it comes to safety factors or dual diagnosis. We would just kind of approach it a little bit differently. And as you were mentioning, probably like slow that process down and take longer in the initial phases of
Mhm.
EMDR before we actually get to the trauma resolution intervention. And that's actually also another good thing to kind of touch on, because in my experience as a basic trainer, I find that when people come to a basic EMDR training, they think they're just getting a trauma resolution intervention.
Right. I was thinking that's like the main thing that it's associated with. And kind of it's I love that you're talking about how all these different areas can be used. I mean, I could see somebody coming in for relationship distress
Yes.
and, like you said, attachment, anything else it could be used with. So that is funny that the stereotype is EMDR is for trauma.
Yes,
You're saying it's way
exactly.
broader than that.
Oh yeah, way broader. In fact, some of my own work on this has been on ambiguous loss, so like the loss of a friendship, and
Mhm.
then also perfectionism in my
Yeah.
business. EMDR actually allowed me to publish my private practice website, which is pretty cool. But
Yay.
kind of back to what we were touching on there, with it being an actual model, like people
Mhm.
tend to think it's just a trauma resolution
Right.
intervention, and that could not be further from the truth. EMDR is actually an 8 phase comprehensive therapeutic model, meaning that with EMDR, you could take a client all the way from intake to discharge within that framework. And as long as you kind of know that framework, you begin to understand that even the 8 phases, they're not necessarily linear. There's a lot more
Mhm.
ebbing and flowing, and they're more circular in nature than they are actually linear. But all of those things are things that we actually get to go into in way more depth in the basic training. So,
Yeah, but I love that too, that even if there's this handbook, there's a protocol. It is not after 1, do 2, after 2, do 3. Like, because sometimes you'll do 4 and then you got to go back and do 2 because some of the stuff that came up in 4, you realize there may be some deeper things going on here or more resourcing that needs to happen as the reprocessing is going on. So then you jump back to 2.
yep,
So there's lots of flexibility here. And I think that's something that's important for people to remember too. And I
yeah,
like how you're saying you can tailor it to different clients. So even with I just keep thinking the handbook because it's behind me from my training is like picturing that and being able to know that yes, there's this protocol that maybe helps you feel safer as a new therapist, but it doesn't lock you into anything. You can kind of within reason be able to mold it to the client you're with to be able to come back or move forward as needed too.
yeah. Or even to yourself as a therapist. And before I kind of go into that really quickly, just for anyone who's, maybe watching or listening who doesn't know, a resource at its most basic definition is just anything that can bring up a good feeling in the client's body. So,
Yeah.
in particular, in EMDR, we have certain resources. They call it the safe place. I don't actually
Mhm.
call it that. I say peaceful place, because sometimes that can actually
Yeah.
be kind of a triggering term for certain populations or folks. But where we would have them imagine kind of a peaceful scene, or things like the container, where we teach people
Mhm.
how to kind of in a healthy way compartmentalize different things that might come up for them as they're going through the process. But yes, EMDR is structured, and a lot of times through your basic training you're going to get scripts. I know that's something
Mhm.
that I really kind of focused on as I've been developing my own training, is even just like making sure the workbook and the manual are pretty
Yes.
colorful and have
Yeah.
pictures, but yes, that you have scripts so that when you're doing EMDR for the first time, you really aren't getting thrown to the wolves. There is a stepwise process. There are even examples of what you can say to the person. And
Mhm.
really, as long as you stick to the script, it's going to work. And that's what people are always shocked about in basic training is they are brand new. They are reading right off the script, and they know it's not as good as it could be, but their client, air quotes, still gets better.
Yeah.
So, and EMDR, for me as a clinician, I kind of view EMDR as like this container, and
Mhm.
then all of my other therapeutic modalities fit into that container.
Mhm.
So I do parts work. That's something that I do a lot of with my clients in EMDR, and that fits so nicely in all of the phases of EMDR, but in particular, in the actual processing or trauma resolution phases, which I would say are like 3 through 6
Mhm.
of those 8 phases. And then I also do like somatic interventions. I also do biofeedback. So more of like the
Mhm.
resilience resourcing and things like that. So
Yeah.
really, whatever modality you are already trained in, the likelihood is that EMDR could be a really nice support or addition to your existing toolbox.
Yeah, it sounds very complementary to pretty much any other modality at this point.
Yeah.
Um, Well, I know you've mentioned a lot of the pros, which is like everything with EMDR because you can use it with everybody. I feel like as a clinician too, which I really appreciate that you did, was you mentioned the pros for the therapist as well, not just for the clients.
Yeah.
So and then there's probably more we haven't covered yet, but I'm sure we will. Are there any cons that you could think of with EMDR, either as the clinician or potentially as the client? And
Yeah.
maybe cons is strong. Maybe it's more like holdups or things that you've seen come up for people.
Yeah, how I frame it in my informed consent would be risks and benefits, right?
Yes, perfect.
So, maybe some of the risks with EMDR I think are, pretty similar to other therapies.
Mhm.
And I think this is an important, it's good to be an informed consumer of EMDR. And I know
Mhm.
that this podcast is for new therapists, but I would say that they may at some point be in consumers of EMDR therapy as well, or to even empower your clients to be informed consumers of EMDR therapy. Um, Anytime you're doing any sort of work with, trauma, things of that nature, there is the risk that if you go too deep too fast or you do too much too soon, that could actually make things worse. So
Mhm.
that's important to kind of recognize that, with EMDR, it's a marathon, not a race,
Yeah.
right? It doesn't always have to be kind of this, we're going to dive head first and work on my first and worst trauma. And I actually recommend, especially for new EMDR therapists, that they take more of a wade in the water approach, where
Mhm.
we start with things that are more present and future and more mild and moderate on those, disturbance scales that we use, because it effectively allows the client to like dip their toe in the water of EMDR
Mhm.
and hopefully have a positive first experience of
Yeah.
EMDR and then want to come back and do more. So that's a potential risk. Just like with any other therapy, results can't be guaranteed. It really is
Mhm.
going to depend on a number of factors, and even things that are beyond the therapist's ability to control, the client's willingness to show up and engage,
Right.
the client's capacity
Mm.
to show up and engage, and even connect with their emotions and sensations. Because kind of the premise of EMDR is feeling it to heal it.
Mhm.
Um, Trying to think of any other potential risks that might be involved.
I know some people tend to process for a few days after, correct? So maybe that just a new sensation, like you said, with informed consent, being able to understand that as a therapist and also explain that to clients. So you're not getting those calls of, well, I'm still feeling weird and it's been 2 days, or, some of that stuff. I think that could be a risk if you don't fully explain everything about the process.
Absolutely. And more to your point, not only is that something that we emphasize in the basic training, that actually one of the last things your client should hear you say anytime you've done any trauma resolution work with EMDR is this idea that processing may continue.
Mhm.
And that also kind of brings back the importance of that phase 2 preparation and resource work, because
Yep.
we're not going to take someone into trauma processing without first making sure that they have a way to emotionally recover should that
Mhm.
processing continue, and that they have something that's effective for them. So, again, kind of a prerequisite before we would start the trauma processing within the context of EMDR is that we would need to see, and the client would need to be reporting to us that they're successfully using their tools and their skills outside of therapy.
Mm.
If they have a trigger, or, they need to cope in a moment where they don't like how they feel. But yeah, that would definitely be something, that's, I would say, more of like the informed consent.
Yeah.
But yes, absolutely, processing may continue, and that could be new insights, new memories, but it's not always necessarily negative. In fact,
Mhm.
that was one of the things that I found in my own processing, especially after I processed kind of the loss of that significant friendship. After my EMDR session, I actually had a lot of positive thoughts and feelings coming up about that relationship, which for
Oh.
me was just amazing, considering that, for the time after losing the relationship,
Mhm.
I couldn't even really think about it without getting sick at my stomach and welling up with tears. And so, to kind of have some of that good stuff coming back, can be really, really hopeful and empowering too, as a client of EMDR.
Yeah, you kind of clear away some of the cobwebs of the recent drama to really be able to appreciate those past memories, history, stuff like that. Doesn't make it so black and white anymore.
Yeah,
Like,
definitely.
that's really helpful as well. I have a random question that I thought of as you were talking. So I know there's the 8 phases and all of that. And everybody can kind of look into that's like the basic stuff they can research of what they all mean. But I was curious I know if there's different ways that people go about whether it's like tapping, whether it's audio. So what's your favorite way of doing that bilateral stimulation to
Yeah.
help with the processing?
Yeah, and if it's helpful too, I don't mind to run through the 8 phases really quickly as well.
Yeah.
We always tell people, like, if you memorize the 8 phases of EMDR, it's going to be really hard for you to get lost. And one other disclaimer that I just want to put out there, according to the International Association of EMDR, you do need to be basic trained in order to be
Mhm.
using EMDR with clients. So if this podcast gets you really excited, you want to go and do your own research, we absolutely encourage that.
Yeah.
Um, and you also want to make sure that you get a reputable basic EMDR training if this is something that you want to begin utilizing with your clients. And I really wish that I had this modality as soon
Yeah.
as I had graduated from graduate school, because it really, I think, would have been a game changer. But phase 1 is what we call history taking. In phase 1, we develop what we call a target plan, which is kind of like a treatment plan for
Mhm.
EMDR. And it identifies those past environments, relationships, and experiences that are connected to whatever the client wants to work on. Phase 2, we call that preparation. You might also hear it referred to as resourcing.
Mhm.
That's where we're doing a lot of the informed consent, building the therapeutic relationship, helping our client to establish those tools for bringing up good feelings or for shifting their internal experience if they don't like how they're feeling. Then we are now going to be entering into the trauma processing intervention. So, phase 3, we call that assessment. That is the first component of the trauma intervention, which is intended to be done together. Second step in that intervention would be phase 4. We call that desensitization. And that's where we start either the fancy eye movements or the tapping. In EMDR, we call that bilateral stimulation. And we can chat about that in just a second. Phase 5, we're still in that trauma resolution intervention. It is called installation. And this is where we're really helping the isolated negative neural networks up here to kind of begin communicating with the adaptive networks that
Mhm.
it's been cut off from. And then the final step in that trauma resolution intervention would be phase 6 of EMDR, which is the body scan. And that's just kind of a last step that we take to make sure that the body has been fully cleared, because we know that memory, much like you said earlier, is
Yeah.
not just stored here, it's also
Mhm.
stored in here. Uh,
Yep.
And then the next phase of EMDR, which again, we're going to do this next phase anytime we do any sort of EMDR, we call it closure. So
Mhm.
we would do closure at the end of processing sessions, which would be 3 through 6. We would do it at the end of target planning sessions, which could be phase 1. And then our last phase of EMDR, we call that phase 8. It's reevaluation. And we do reevaluation anytime we've done any of the 3 through 6 trauma intervention phases. It's a way to kind of check back in, figure out what progress we've had, and kind of evaluate and determine the need for more work. So kind of as you said, one of the mechanisms that is within EMDR, kind of one of the reasons why it works, so to speak, is bilateral stimulation.
Mhm.
And that's just a fancy way to say anything that crosses the midline. So actually, Francine Shapiro discovered EMDR when she was going for a walk, right? So
Mhm.
walking is actually
Yeah.
a form of bilateral stimulation. But the story goes that as she was walking in the woods, she was thinking about something that was upsetting to her. And she noticed as she was walking, her eyes were moving back and forth. And then after a while, she realized that thing that was upsetting for her was just not as upsetting to her anymore. And so that kind of prompted her to start then recreating those eye movements with colleagues and, friends, things of that nature. And that led to the initial studies of EMDR. And I think the initial study was from 1989. So
Wow.
since then, again, knowing that it really actually all started with the walking,
Yeah, it's
pe-
crazy.
people started then doing research on other forms of bilateral stimulation. And actually, if you were to read Francine Shapiro's work, you would see that she's actually said, if I could go back, I wouldn't have named it eye movement
Mm.
sensitization and reprocessing, because we now know that some of those other modes of bilateral stimulation, you sometimes do tapping, some people do tones,
Yeah.
which would be like, sound going back and forth from left to right. But those can be effective as well. I think according to the research, it seems that eye movements and tapping are probably the most effective when it comes to reducing images that would be associated
Mhm.
with past memories. And again, I want to be clear here, y'all. Like, we've been using the word trauma, and I think that's kind of a buzzword. I would love to just give a definition of trauma that can help us recognize that it's so much more than what
Mhm.
they tell us in the DSM, because
Yeah.
really trauma is any experience that involves some degree of loss of control or vulnerability and intense negative feelings. Those are the only things that have to be present for something to be considered a trauma.
Yeah.
When we have that definition, and that actually comes from Margaret Blaustein, one of the folks from that course I took with Bessel way back in the day, we begin to recognize that, again, trauma is so much more than we give it credit for. And being bullied on the bus, and being called
Mhm.
out by our teacher in front of the class, or nowadays by our boss in front of our coworkers, like
Yeah.
those sorts of things can negatively impact us, and then in the future change how we show up in terms of how we think, feel, and behave.
Absolutely. And I think that that's something clinicians need to work on with their language with clients as well. Because I
Yeah.
think sometimes people say trauma, and I've had clients be like, well, I haven't had trauma. I haven't had like somebody, I haven't seen someone die, or they go to
Right.
these very extreme forms and definitions of it. And
Yep.
it's like, well, no, this relationship you just described was traumatic, or
Yes.
your mom leaving at a young age was traumatic, whatever the situation was. But I think the definition's a lot broader than what most people tend to think it is.
It really is. And so for me, in my work with EMDR, it's definitely been an evolution with the bilateral stimulation.
Mhm.
Before 2020, I actually was using these things, we call them buzzies, and I'll show you because I know we're going to be on video here.
Yeah.
But this was my primary method for delivering bilateral stimulation, for a couple of reasons. Number one, because I found that when I was doing eye movements, it made it harder for me to attune to the client, because I was so focused on the way that my arm was moving and making
Mhm.
sure that their eyes were tracking, that I
Yeah.
was missing other important nonverbal cues. I also work with populations, first responders, military, that are really good at disconnecting from their internal
Mhm.
experience. So some of these folks, having their eyes open, they weren't getting enough access to the memory or the emotion and sensation. So with the buzzies, they were able to close their eyes and then
Mm.
receive that bilateral stimulation, by holding on to these little pads, and they would just put them
Very
in the
cool.
palm of their hand. So, tactile, even before, right, the
Yeah.
pandemic, I was primarily a tactile EMDR therapist. Not to say that there can't be really good reasons to use eye movements, and some clients will actually have a preference either way. So
Yeah.
I am always, kind of trying to gauge what's going to work best for the client in front of me. Um, but even for my own EMDR, I prefer the tapping because I
Mhm.
like the ability to kind of go into my own world, because EMDR, it just feels like you're in another dimension when you're processing, and all these different things can be coming up inside of you.
You're seeing and hearing and feeling all these things all at once. And maybe sometimes having I mean, I thought the same thing from it. Having your eyes closed helps you be more attuned to
Yeah,
everything else that's going on. You close off one of the senses, all the other ones felt more heightened to me.
exactly. Yeah. But there is the option to do either. Folks can do
Mhm.
processing with eyes open, they can do eye movements. Again, they can do tapping, or they can do tones. So,
Very
yep,
cool.
I just tend to prefer the tapping. So,
Yeah. And I think that that one's nice as well for when you're doing like the positive pieces, because I know it's like fast movements, right? For reprocessing some of the negative. And then for what's the word where you're doing like installing like the
yes.
positive. It's been
Yeah.
a minute. So when you're installing the positive, for clients to be able to have that as a coping skill as well, to know the tapping, just doing it at the correct speed is really
Yeah.
helpful.
Exactly. And there is something to differentiate there too, because when we are in 4, 5, and 6, we're
Hmm.
doing what I like to call rabbit speed, meaning that all of the bilateral stimulation we do should be fast. And
Yeah.
some folks get confused. They start to think, oh, because I'm focusing on something positive in phase 5, I should be going slow. But
Hmm.
really, we do fast in 4, 5, and 6. And then
Hmm.
in phase 2, we teach people what I like to call turtle taps. And those are something that they can use as a coping skill outside of therapy, because that slow rhythm is actually going to be calming for the nervous system.
Mm.
The only reason we wouldn't want someone doing the fast tapping outside of therapy is because that can actually activate their
Yeah.
nervous system, which is part of why processing works, because we're activating that nervous system. So then we can desensitize it, or like I like to say, turn down the volume on the
Hmm.
disturbance around it. So
Yeah, I like that. I could tell you're such a good trainer because you say things in a normal way. It doesn't sound super book, because I'm not a big fan of the very formal, because also sometimes the education that we're given in these trainings, we start, especially when you're newer and nervous, spitting it out in the same way. And clients are like, what?
yes,
So I like that you say it in a way that's not only easily digestible for the clinicians as they're using it, while also understanding all of the layers and clinical neurobiology, everything in it. But it gives them the language to also be able to share that with their clients so they understand it. So
absolutely. Yes, because when you're going through the basic training, you're already learning a new skill. And again, it is so different from the
mhm.
basics that they taught us in graduate school.
Yeah.
There is a language, there is a lingo to EMDR. And so anytime I'm teaching about EMDR, or anytime I'm just talking about EMDR, I allow myself to use the lingo, but I also
Mhm.
try to define it after I use it, because it's like, what? Wait,
Right.
what are we talking about here? So it can be really helpful to not only use the lingo, but then kind of give a definition so that, folks are tracking, what are we talking about when we say this?
Mhm.
So
Yeah, I love that though. It's multi-layered and I appreciate that, because otherwise I feel like it's almost like when you're in class and the teacher says a word you don't know and you're like, everyone else looks like they know it, so I'm not going to raise my hand and ask, and I feel like a lot of people, at least in the training I did, that's kind of how people felt. And then once we did into the smaller groups, they'd be like, what did that mean? Or what were they talking about? But with
right.
you giving, here's the basic, like the actual clinical words for it, what the manuals will say, what the books will say, but here's what it really means. I think it also sticks better in your mind. So
Right. It's
I like
like,
that.
here's the term, here's the translation. So
Yes, exactly. That needs to be on your website somewhere for the training. I won't just throw the terms at you. I will translate them into a way that's practical.
absolutely.
Which, speaking of your training, how do you think, because you mentioned how this would have been so helpful for you to have earlier in your career. So how do you think that your training as going through EMDR, being a trainer, being a clinician, being the client, how do you think all of that has shaped your practice over
Oh,
time
wow.
as a therapist?
That's a great question. And I mean, in so many different ways, like EMDR has just opened so many doors personally and professionally. From a professional standpoint, EMDR, really became an opportunity for me to diversify my clinical practice so that I wasn't always just doing client work, because we know you can really burn out if you're just doing, Monday through Friday, 9 to 5, seeing trauma patients. So for me, it allowed me to diversify, what I was doing in a way so as to preserve myself and prevent burnout. Because I've had the opportunity to become a coach, a consultant, and now a trainer for basic EMDR. EMDR has also provided me with the opportunity to again work through professional and personal blocks. I've worked through so many of the my own patterns, that just
Mhm.
show up. Personally and professionally. And I know I mentioned the perfectionism. Without EMDR, I don't even think I would have been able to publish my private practice website. And it was only after doing EMDR processing on publishing it that I actually did put my website out there. And now I have a full private practice. So I
Yeah.
wouldn't be where I'm at without EMDR in so many different ways. And I think as a clinician, it is so rewarding to again not be in this place where it's like I'm the guru with all the answers. I'm just a conduit for you to access your own healing. And
Mhm.
it is such a joy and an honor and a pleasure to see the transformation within my clients, even in just a session.
Mhm.
People can be so moved by what can come up in EMDR. And so I think for me, that's really the way that it's impacted my clinical practice. And it's really led me down, this path of going deeper and deeper into those more bottom up approaches. So I would kind of say that EMDR is a part of what has established me in knowing who I am as a therapist and what my approach is. And that's awesome now that I'm in private practice, because when I get a client who's calling and wanting to consult, I can say, hey, here's what I offer.
Mhm.
Here's how I show up, and here's what you can expect. And if that's, what you're interested in, awesome. Let's figure out how we can work together. And if not, let me help you find someone else who is maybe
Mhm.
what you want to work for. So
Yeah, that's amazing. And that itself takes confidence to have some of those conversations, especially when you're newer in business, because business is also something that's not really taught in grad school.
ab-
So learning that along the way. And like you said, being a consultant trainer, you're out there a lot more now. So it also helps that it's something you're passionate about, because you can tell as you talk about it that you like it.
yeah.
And
Oh,
so
I love it. I don't just like it, I love it.
you love it. Yeah. Can you show people your shirt, by the
I can. I
way?
can. Y'all, this is from my Etsy shop. This is Keith
Yes.
Coleman, call an EMDR therapist.
So cute. I love it. So, yeah, it's like part of your clinical identity. And I love that you've embraced it so much and you're able to help other people find that same passion for what they're doing and also be able to help their clients in a whole new way. It's very
Absolutely.
cool.
Absolutely. And even themselves, right? Because in
Yeah.
the basic training, and that's maybe something to know if you're someone who is like, ooh, now I'm interested. What about this EMDR stuff?
Mhm.
In the basic training, you are actually expected to do and receive EMDR. So that's just something to kind of keep in mind, is that make sure that you're in a place where you're ready to do some
Yeah.
of your own work, because you are expected to work on real things within the EMDR training.
A couple
So
times as
yep,
you learn
yep,
different.
throughout the week, actually. It's about
Yes.
half and half.
Yeah.
So, Andrea kind of sets the standards for basic training. And they say it's about 20 hours of lecture and about 20 hours of real-time practice, where again, you play the role of both the client and the clinician. But again, I think the real benefit in that is that then the first time you do EMDR with a client in your office, it is
Mhm.
not your literal first rodeo, right? Like
Absolutely.
you've been in that rodeo a few times, at least at that
Yeah.
point. And you also then get consultation hours after your training that you can use to get some support along the way, because we don't just throw you to the wolves after training. So,
Right. And something else you mentioned that I did want to hit on too, because there's so many different people, organizations, whatever it is that put out there that they train people in this. But if somebody wanted to get certified, they would have to go through the official organization, correct?
so certification is actually a different level than basic training, which is
Right.
a big point of confusion. Basic training, it really is just taking the course and completing the consultation hours. They
Okay.
used to kind of say that it was in levels. As far as I know, there aren't really levels.
Mhm.
Sometimes you do it in two parts, which they
Yeah.
may kind of frame that as levels. But again, once you've completed your 50-hour basic training, which is 20 hours of practicum, 20 hours of lecture, 10 hours of consultation, then you could advertise that I've received basic training in EMDR.
Hmm.
You want to then go and get certified, yes, you would have to become a member of EMDREA, and then you would have to go through an additional process. They require additional consultation hours, additional
Hmm.
training that's approved through them. You get letters of recommendation, some other little things, but they have all of that information on their website. And that's maybe another good thing for people to know too, if they are interested. EMDRIA.org, EMDREA.org is actually the website for EMDREA, and they have lots of great resources, not just for clinicians, but also clients who are potentially interested in EMDR,
Yeah.
including an EMDR Find a Therapist tab. So if
Oh.
you are a clinician and you're looking for an EMDR therapist, that can be a resource, or you can come and see me and we'll do an intensive.
Yeah, that actually sounds really cool. I want to ask you about that when we're done. Um, but I was under the impression, and maybe this is wrong, this is why I wanted to ask, that you, in order to eventually be certified, your basic training had to be through somebody who was from EMDRIA, because I've seen people, maybe like PESI or different places that are like, we'll educate you on EMDR. And I've seen people pay for that, but not really understand why they can't level up. So is
Yeah,
that true that your basic
that is,
training?
you hit the nail on the head. If
Okay.
you want to participate in the certification and the other things, you would need to make sure that your basic training is EMDREA approved.
Mhm.
That is something that should be clearly stated, though, on the website of whoever you're going through for your basic training. And if you're not sure, I would send an email and ask, especially if you do think that you'll be interested in, moving on further down the line for certification.
Yeah, I just wanted to double check on that because I know some people look at cost and they'll pick the cheaper option, not understanding that it's cheaper because
Yeah,
they're not, certified or cleared from that organization. So now they can't necessarily move on if they are interested in certification. So, mm,
definitely.
yeah. Well, you've already given us a ton of information today, but is there any additional tips that you could think of for new therapists? Any advice you'd want to pass on or anything that you wish you knew sooner in your career?
I think, just my advice would be to continue to have an open mind. Don't be afraid to keep learning. Don't
Mhm.
be afraid to pursue things that are maybe against the grain or outside of, the major things that you're taught in graduate school, because that can really lead to some unique opportunities and passions that you may find that you have. Um, and I think, yeah, I mean, if you are someone who wants to have your own business, also, I just recommend pursuing education on, business building and how to become
Mhm.
a business owner and entrepreneurship. I'm trying to think, there is the name of, and it's blanking on me now. There is a national organization that you can get like a free business mentor.
Score?
Yes, SCORE.
Yes. Mhm.
Yes. And that's something, that again, if you are a clinician, because we don't get that training, SCORE was actually a place that I started when I started my business. I went and got a free SCORE mentor, and that was very helpful, at least in taking a step in that direction and
Mhm.
learning the things that I didn't know, because you don't know what you don't know until you
Yeah.
know it, and then you got to learn about it. So
Mhm.
that
Yep.
even might be, a little tidbit for my, future entrepreneurs out there.
Absolutely. Yeah. And it's going to help so much because there's so much stress and imposter syndrome, all these things that come up when you're starting a business. So I think that that would be really helpful, that for people to know also there's the free resources. Not everything has to be, especially when you're starting out, paid. So,
Yeah,
or if you're going to pay, invest in the things that
exactly.
really have a good return. So
Absolutely.
makes sense. Well, what else are you working on right now and where can people find you?
Ooh, so many irons in the fire.
Love it.
Well, I think, a couple of different things that are coming down the pike. So, I mentioned the resilience focused basic EMDR training
Yeah,
that hasn't been released just yet. And I'm also working on some advanced level EMDR trainings for anyone who's already EMDR trained.
very
So if
cool.
anyone wanted to know more about that, you could follow me and join my email list at www.brainbasedemdr.com.
Love it.
So join us on the mailing list, and you can be in the loop as soon as we kind of roll out the curriculum, and also just keep you in the loop of any other trainings that we're doing. I'm actually getting ready to go to London and speak at Ernesto's Not Your Typical Psychotherapist. So
Yay.
preparing for that and just getting so excited for the experience. I'm also working on kind of doing some transitions in my private practice as well. I'm thinking of going more toward the intensive model only, and
Wow.
I've come up with a funnel. Everybody has funnels these days, and
I
so I
know.
I think I'm gonna work on transitioning to doing some corporate speaking, and then doing like a self-paced resourcing course, and then having my intensive as an option there. And then, as if that wasn't enough already, I'm actually working on a book. So
Oh
that's
my
kind of
gosh. Oh, that's so exciting.
yeah.
Oh, what an icon. Like you're just out here doing all the things. I love it though, but it also what the thing I love the most is everything you just said. None of this stuff was spoken about, not even just in like my grad school, because I don't want to put everything on them.
Yeah,
But in places I've worked, maybe like mentors I've had, a lot of therapists, I feel like, and this is why I'm now surrounding myself with the right ones.
yeah.
Um, they were very like, this is the way it is. This is the way. This is how you do it. You're going to do clinical work forever. Maybe you go into private practice and then you're there till you are too old to work or you don't want to work anymore.
Exactly,
And
until you're
that
a crispy critter.
exactly. And then that was it. And so I feel like there's so many places that we can go to in our career. And I love that all these things you just said, it's like a spider web and there's all these different places that it can expand to. And it just keeps growing.
Yeah.
So cool.
And maybe that's the best advice that we could give the new therapist is
Yeah.
find your tribe, like find your
Yes.
people, because they are out there, and it may take some time, but find them, because
Yeah.
that's going to be a good thing for you.
Right. And that's who's going to understand you. I've seen too over time as I've been expanding and doing more things that not everybody gets it and not everybody gets you and what you're working on. So it is
Yeah.
very important to have those people who not only understand it, but encourage it and
Oh,
support.
absolutely. Yes, yes. I firmly believe that when we do things together, when we collaborate, when we co-create, when we just cheer each other on, like we really just increase our capacity to contribute to the greater good. And so
Yeah.
that's what it's really all about.
Exactly. And not everybody can do everything. So I'm glad you do these things because then when I find somebody who needs, I'm like, I know the EMDR person, they'll go to like see Libby. So it's so helpful.
Well, that means so much. Thank you again just for your time today, and even just for, keeping me in mind when you run into folks who have an
Oh,
interest in EMDR.
yeah, especially because I'm in North Carolina. So like that's even more helpful. And with everything you're doing next, I'm like, yeah, there's going to be a lot of very cool things coming through. So for everybody who wants to follow her email list, everything's linked down below. So follow Libby because obviously there's a ton that I'm going to want to pay attention to. And I'm sure you guys will too. So thank you again for taking the time today because I know you're very busy now that I know all these things. So I appreciate you even more being here today.
Absolutely. It has just been an honor and a pleasure. I want to say thank you to you, and thank you to all the viewers for
Yay.
supporting Samantha and all this amazing stuff that she's doing. So
Oh.
it was just an honor and a pleasure. Thanks again.
Yeah, thank you. So for the viewers, if you guys want to follow along with what I'm doing, hit subscribe below. I have my own email list stuff down below and also a Facebook group. So follow me in all the places and you'll get to see all the things. So thank you again, Libby.
Thank you.
Bye, guys.